Dear students, very good morning to everybody. Hope you are all fine. Today's our topic shall remain about the non-communicable diseases. Let us see what non-communicable diseases are, or NCDs. Diseases which remain confined to the persons who suffer from them are called non-communicable diseases, or the diseases which are not transmitted from affected persons to others are called non-communicable diseases. Some important non-communicable diseases are: number A, diabetes mellitus, which is also called hyperglycemia. Number B, cardiovascular diseases. Number C, stroke or cerebrovascular accident, CVA. Number D, arthritis or aching joints. Number E, cancer. Now let's talk about number A, that is diabetes mellitus or hyperglycemia. Diabetes mellitus is amongst the non-communicable diseases and is the most common endocrine disorder of the pancreas. You know, pancreas is a narrow, near about 6-inch long gland which connects to the duodenum. It comprises of various types of cells: alpha cells, beta cells, delta cells. Diabetes mellitus is now recognized to exist in two forms. One form is insulin dependent and the other is non-insulin dependent. IDDM, that is insulin dependent diabetes mellitus. This disease is caused by the failure of the beta cells of pancreas to produce adequate amounts of insulin due to an autoimmune response. NIDDM, that is non-insulin dependent diabetes mellitus. This disease appears to involve failure of insulin to facilitate the movement of glucose into the cells. In both disorders, glucose concentration is elevated above the normal range. Some of the glucose is excreted in the urine and water flows the glucose causing excessive urination and dehydration of the body tissues. This causes frequent drinking of water because of extreme thirst, polydipsia. Cells are unable to utilize the glucose and other carbohydrates for energy production. The person suffering from diabetes becomes weak. There is the degradation of fat increases, producing ketone bodies, which is called ketosis. Later are acidic and poisonous. That means ketones are acidic and poisonous. The person's blood cholesterol level rises, healing power is impaired, administration of insulin lowers the blood glucose level, and the patient gets relief. Now the difference between IDDM type 1, that is insulin dependent diabetes mellitus type 1, which is also called juvenile diabetes, and second is NIDDM type 2, that is non-insulin dependent diabetes mellitus type 2, that is type 1 and type 2. Type 1, it occurs amongst the people who are of less than 20 years age, while as NIDDM, that is type 2 diabetes, it covers the people having more than 30 years of age. In type 1 diabetes, that is IDDM, there is normal weight, while as in type 2 diabetes, that is NIDDM, one becomes obese. In type 1, that is juvenile diabetes or IDDM, insulin dependent diabetes mellitus, ketoacidosis is common, while as in NIDDM, that is type 2, ketoacidosis is rare. In type 1, that is juvenile diabetes, there is severe insulin deficiency, while as in type 2 diabetes, there is relative or moderate insulin deficiency. In type 1, that is juvenile diabetes, beta cell depletion takes place, while as in case of type 2 diabetes, that is NIDDM, non-insulin dependent diabetes mellitus, mild beta cell depletion is there. So these were some points of difference between insulin dependent diabetes mellitus type 1 or juvenile diabetes and NIDDM type 2, that is non-insulin dependent diabetes mellitus. And now we have other types of non-communicable disease, which include cardiovascular disease, stroke, arthritis, cancer, and these will be covered in the coming offline classes, inshallah.